This is Elizabeth. She's a young Kenyan who runs her own small community pharmacy in the outskirts of Nairobi. She's trained as a pharmaceutical technologist who dispenses medicines tablet by tablet to patients in her low-income community out of her 6-square-meter shop. People like Elizabeth play a critical role in many low- and middle-income countries around the world where there are millions of people whose basic healthcare needs are underserved. When I met her, I could see she was smart and ambitious, and I asked what she would need to better do her job. And the answer I expected was something like, I would move downtown Nairobi, where people are more affluent. Instead, she replied immediately, I would need a small lab. That was an aha moment. In many communities like hers, community pharmacies basically give out pills, and there is little focus on health outcomes. Yet, improving the health-seeking behavior of people and disease prevention are critical topics those pharmacies could help to promote. Even further, they could help with early diagnosis and patient support. And that would make them key to tackling the basic healthcare access crisis that half of the world's population is facing. Yes, half. Last year, a report by the World Health Organization and World Bank concluded that half of the world's population is not receiving the essential healthcare service they need, like on maternal and child health, and on infectious and non-infectious diseases. Why do we lag so much behind? I work for a global science and technology company, so you may wonder why I'm talking about community pharmacies dispensing tablet by tablet to low-income Kenyan communities. Well, the traditional business model of pharma has brought amazing, innovative medicines to the market that improve and prolong lives. However, it has remained inaccessible to a huge number of the world's population. Now, the traditional business model of pharma is being challenged in developed markets by pricing pressures and rapid technological advances. And we can already see where things are going to go. We're shifting from just treating diseases to prevention and patient engagement. Let us think about this question again. Why do we lag so much behind, with half of the world's population not receiving the essential healthcare services they need, despite so many scientific and technological advances over the last several decades? When I look for an answer to this question, often I get to hear, there's no market at the base of the pyramid, or it will not be profitable. However, when I looked for related business opportunities in low-income markets, I found many interesting trends. Here are 3. The first trend. The poor and low-income population is actually moving up the income ladder. The second trend. Mobile internet traffic is booming. And the third trend. Digital health technologies and rapid diagnostic tests becoming more advanced, affordable, and even available for the lay user, providing an opportunity to mitigate the lack of healthcare services. All this points to the idea that community pharmacies, such 6-square-meter shops like Elizabeth, could become primary healthcare service points by making a transition from just dispensing tablets to actual pharmaceutical patient care. In other words, if we find ways for the Elizabeth to provide them the tools to do things like health education, basic disease screening, and management of their patients and communities, and to better integrate them into the healthcare system, this would not just result in a positive impact on these communities, this would also represent a sustainable business opportunity. Okay, so how are we going to do this? My team and I look at this through the lens of business rather than charity, since we want to figure out how to improve access to quality, affordable primary healthcare in a way that is lasting, transformative, and ultimately self-sustaining. And the business model for that goes straight through collaboration with people like Elizabeth. The first thing we did was to understand the healthcare system in Kenya and Nigeria, and especially the role of community pharmacies. We found that most of the time people seek first health advice, treatment, and support at community pharmacies, so they avoid the costly trips and visits to physicians and hospitals. However, these community pharmacies, they provide basic things only, dispensing tablets and counseling. Occasionally, they're equipped for measuring blood pressure and blood sugar. And all of this is paid out of pocket, since the vast majority of people is not insured. But the challenges of accessing basic healthcare aren't limited to availability and affordability of medicines. The shortage of healthcare services requires to focus also on the availability of medical services and patient support. And then there's technology. Remember those trends I listed about digital health technologies and rapid diagnostic tests becoming more advanced and even available for the lay user. You throw this into the mix and you have a formula for a point of integrated primary healthcare services for Elizabeth. Then, to understand the local healthcare service gaps, we put ourselves into the shoes of pharmaceutical technologists, nurses, and patients. We did this by visiting primary healthcare facilities and pharmacies. We then brainstormed the business model with local experts from Kenya and Nigeria. And they came from across government, non-government, and private sector. And to give us even a deeper understanding of the model, we developed 5 primary healthcare facilities, composed out of a shop area with a toilet, a dispensary for the prescription drugs, and a nurse area. And we equipped each of them with a fridge, with air conditioning, tablet computers, internet access, TV screens, and some even with solar technology. And all this doesn't sound like much until you add that the tablet computers provide access to a telemedicine solution, to approved digital health apps and devices for checking disease risks and for screening vision, heart, and lung function, and to a patient management system as well. Affordability of healthcare is a huge issue in low-income communities. Therefore, we also help to reduce costs by providing direct access to qualified distributors who directly supply the facilities with medicines, avoiding the multiple markups across the supply chain that often make medicine unaffordable. We are now also looking into novel financing and insurance solutions to help patients be able to pay for their treatment. We set up these 5 facilities outside of Nairobi and leased them in a franchising model to primary healthcare professionals and trained them in business operations and good business practices. We started by learning from Elizabeth, and we are now collaborating with 5 pharmaceutical technologists and 5 nurses. We see them as our first partner in a growing network of entrepreneurs that have both a patient focus and a business motive. We are only at the pilot phase. There is still so much to do. Our plan is to provide primary healthcare services to existing community pharmacies in low and middle income countries. We will help them transitioning from just dispensing tablets to become integrated primary healthcare service points that improve their health outcomes. Like that, we will lead the way into the future of integrated primary healthcare. I realize in our journey so far, there are more and more players in primary healthcare that adopt a strong mindset of purpose and collaboration, leading to sustainable business models. That gives us confidence that we are on the right path. Let us create sustainable businesses that improve lives and reduce healthcare inequalities. And let's start with giving Elizabeth the lab she needs. Thank you.